Communication disorders. Communication is the process of exchanging ideas, information, needs, and desires. When a communication disorder is present, it is hard to develop and maintain contact and relationships with others. It is also hard to gain or give information, control and persuade, create and imagine, communicate feelings, and monitor our own behavior. IDEA, or the Individuals with Disabilities Act, defines speech and language impairments as a communication disorder that includes stuttering, impaired articulation, language impairments, or voice impairments that adversely affects a child's educational performance. It refers to students who demonstrate difficulties with exchanging knowledge, ideas, opinions, desires, and feelings. Speech and language impairments are also classified as a communication disorder. The prevalence of elementary students with communication disorders range from 7 to 9%. The number of students receiving services for speech or language disorders are at about 18.7%. Many students receive speech services in early grades and are often readily connected by the end of elementary school. Most students with communication disorders have the most difficulty with language and articulation. It has been found that boys have a higher prevalence for communication disorders. Communication disorders can be caused by a number of things. Communication disorders in a child can be caused by physicalities such as problems in brain development, exposure to poisons or toxins during pregnancy, or genetics. We also wanted to take a look at 3 different types of communication disorders. The first type of communication disorder is a speech disorder. A speech disorder is diagnosed when individuals have a hard time with verbal means of communication. It can impact the way a person creates sounds to form words. Stuttering is also very common. Articulation, fluency, and voice disorders may be present. The second type of communication disorder is language disorder. Students with language disorders struggle with forming language such as phonology, morphology, and syntax. A person with a language disorder tends to have persistent difficulties in learning and using various forms of language. The final type of communication disorder is hearing disorder. Hearing disorders or hearing loss can be caused by a number of different things. Commonly speaking, for students with impaired hearing and deafness, it can be caused by genetics and heredity, ear infections, and trauma. Whether it is being continuous or fluctuating, if the disorder adversely affects a child's educational performance, it is considered a communication disorder within deafness within IDEA. Most students with communication disorders are identified in early years, such as preschool or early elementary. Teachers can do a few things if they suspect that a student has a communication disorder. They can talk with a speech and language specialist in the school district and ask them to observe the student in class, as well as interact with them. The teacher can also call the parents or family of the student and discuss the student's communication at home. They can determine if the student needs an evaluation for possible language delays or disorders by taking language samples. As always, early detection is key. Some characteristics of speech disorders are: with speech and sound disorders, a student's speech can be difficult to understand. For students with voice disorders, their voice may be harsh, hoarse, raspy, cut in and out, and show sudden changes in pitch. Fluency disorders involve stuttering. Stuttering happens when there are abnormal number of repetitions, hesitations, prolongations, or blocks in this rhythm or flow of speech. Students with language disorders might experience difficulty using speech or writing. Students with these disorders are referred to speech-language pathologists. They are also known as speech therapists. This is a speech expert who treats children who are having problems communicating. A speech-language pathologist will work with a student to improve their communication skills. They will work to prevent, assess, diagnose, and treat individuals with communication difficulties. Parents, teachers, and mental health experts may also be involved. It is important for education professionals who work with students with communication disorders to consider their potentials and work to help them succeed. They can begin by applying UDL practices in the classroom and collaborate with a speech-language pathologist to identify and implement the appropriate representations, actions, expressions, and engagements for the student. Working closely with a speech-language pathologist will help the classroom teacher to determine the best practices for the student. Third, providing opportunities for the student to communicate in the classroom is also important. Giving them the necessary tools such as subtitles and moving them closer to the speaker are good examples. Having a safe environment where students feel comfortable communicating within are also important. The last suggestion is to model and teach language to help the students improve in their oral communication skills. It is also important for parents to keep some considerations in mind. First of all, children are malleable and they learn to communicate with speech and language skills from those around them. What they hear and see is what they learn. Secondly, parents can help their children by providing them with lots of opportunities to listen and talk. Again, this is how they learn. This can be done by reading and talking to them. Modeling is also a suggestion. Having your child repeat words after you is a great method to engage in their learning. And lastly, talk to teachers and speech-language experts to learn what additional tools you can use to best support and help your child.